Most patients with cancer are treated by surgery, and the cure for the disease is best achieved by removal of all of the cancerous tissue. At the same time, however, the procedure should also be tissue sparing to diminish post-operative morbidity and maintain quality of life for the patient. The surgeon's challenge, therefore, is to maintain a balance between performing a wide enough resection, but at the same time prevent pointless removal of healthy tissue. And the weight that is given to tissue sparing, of course, very much depends on the tumor type and the area that is being operated in. For instance, if we compare surgery for head and neck cancer to surgery for colon cancer. Whether a resection of a tumor has been complete is determined by the status of the resection margins. And for the patient, it is very important that adequate resection margins are achieved, because this will mean a decrease in local recurrences, it will improve patient survival, and it will prevent patients from undergoing additional therapies. In 5 to 60% of resections, however, the margins appear to be inadequate upon histological analysis afterwards. And this in turn questions the reliability of the currently used strategies for intraoperative margin assessment, which include visual and tactile feedback by the surgeon and intraoperative frozen section analysis. This has inspired the development of many novel imaging techniques that aim to improve intraoperative margin assessment. Our aim was therefore to provide an overview of novel imaging techniques for intraoperative margin assessment by conducting a systematic literature review. To this end, we included studies that investigated an imaging technique with the aim for intraoperative margin assessment and included human subjects and had histology as a reference standard. We extracted data on 4 domains, which included patient anesthetic characteristics, technical properties of the imaging techniques, feasibility in clinical practice, and diagnostic accuracy. And finally, we used the ideal framework to classify the study phase. In total, 134 studies were included, and from the graph it becomes apparent that the number of publications increases steadily each year. We can also see that most studies were in the early stages of research and development, namely in ideal stage 1 and 2A. The most frequently investigated cancer type was breast cancer, second by head and neck cancer. We categorized the imaging techniques according to the underlying physical mechanism or principle, and we found that 16 different imaging categories were investigated. And as you can see in this graph, most of the studies investigated the technique in the fluorescence domain, followed closely by ultrasound and radiography. We also see that much lesser known categories were investigated, such as photoacoustic imaging, hyperspectral imaging, and pH measurement. Only 44 of 134 studies reported all technical properties, including the scanning area or the volume, the resolution, the acquisition time, and the penetration depth. And only 33 of all of the studies reported on diagnostic accuracy or margin assessment. Furthermore, we found large variations in technical properties and diagnostic accuracy within imaging categories. So what you can see here in the graph on the right is a heat map of the feasibility criteria. And what we see here is that the more conventional and established techniques such as ultrasound and radiography scored relatively high on feasibility in clinical practice. And what we see is that the relatively new techniques down below, such as the pH measurement, Raman spectroscopy, and hyperspectral images, scored relatively low on feasibility. So as most of the techniques that we found were in an early stage of development, we cannot recommend any of the techniques as most promising for clinical practice, because we think that this type of data is insufficient to justify the clinical merits on a broad scale. We also found that high quality ideal stage 2B and 3 studies were lacking, and well, we can expect this behavior from newer techniques because they're in development. But surprisingly, we also found that this was the case for the more conventional techniques such as ultrasound and radiography. And we urge the use of frameworks such as IDEAL because this can really help researchers in determining the next research step and choosing the relevant research designs, and also reporting the relevant outcomes for each of the research states. So to conclude, we see that the field of imaging techniques for intraoperative margin assessment is one that is highly evolving, and our review provides a unique overview of the limitations and opportunities of these techniques. Considering the plethora of techniques that we found, a recommendation of any specific technique to clinical practice would have been very helpful. However, since we see that the current evidence mainly consists of early ideal stage studies, such a recommendation is not supported. Finally, the framework that we created, in which we did a comparison of all the techniques, could be very helpful for surgeons in selecting an imaging technique that meets their specific needs, and it could subsequently guide research and development of promising techniques. Thank you for your attention.